So question number 2 said, the nurse is admitted a client with a possible diagnosis of Guillain-Barre syndrome, right? So Guillain-Barre syndrome is a common neurological disorder. So I have if you go in the YouTube channel, I have a compare and contrast about some few neurological disorder like multiple sclerosis, Parkinson disease, then Guillain-Barre, Alzheimer, myasthenia gravis, and Huntington disease. So I try to discuss and compare and contrast these 5 diseases together. Is easy for the student to remember. But now I'm going to focus in Guillain-Barre, right? So Guillain-Barre, it is a respiratory problem, neurological problem, but attack the respiratory system. So Guillain-Barre is an autoimmune attack of peripheral nerve myelin. So question, the nurse is admitted a client with a possible diagnosis of Guillain-Barre syndrome. When collecting data to develop a plan of care for the client, the nurse should give the priority to which of the following. So there are few points you should know about the Guillain-Barre, right? I told the Guillain-Barre is an autoimmune attack of peripheral nervous system or myelin sheath. The most common symptom, they cause ascending paralysis or dyskinesia or inability to move voluntary, inability to move, right? So here we go. There are 4 options. So which is the priority? The nurse should give the priority to which of the following? In Guillain-Barre, patient is die because of respiratory paralysis, right? So out of here we say orthostatic blood pressure not related to the Guillain-Barre, presence or absence of knee jerk. If any kind of neurological assessment, we must check for reflexes in the body. But in this question is we will check, but it is not the priority. In case of Guillain-Barre, there are other signs and symptoms rather than the reflexes. And pupil size and react to the light. Also, it is not mandatory for Guillain-Barre. As I told before, Guillain-Barre is an autoimmune attack of the peripheral nerve, and the major symptom ascending paralysis, and patient has a dyskinesia or inability to move voluntarily, and finally respiratory system failure. So we can check the respiratory rate and depth. Respiration is okay or not. It is slower or rapid. So rate and depth of respiration is most priorities. Let me read their explanation. Guillain-Barre is acute immune-mediated polyneuropathy that is the most often accompanied by ascending muscle paralysis and absence of reflexes. But here showing about the reflex, presence or absence the reflexes. It is important. I could check, But my patient will not die because of reflex. My patient will die if the respiratory system suppressed or stoppage, right? Or failure. So lower extremity weakness progress over the hour to day to involve the thorax, arms, and cranial nerves. Neuromuscular respiratory failure is the most common and most dangerous for the life. It's a life-threatening complication. The rate and depth of the respiration should be monitored, and measurement of the serial bedside force is called vital capacity of the lungs. Is a good standard for assessing the early ventilation failure, right? If you ask me what are the treatment of Guillain-Barre, in case of Guillain-Barre, we can give them anticoagulant or intravenous immunoglobulin, shortly called IVIG, or plasmapheresis. But if your patient need to plasmapheresis, we could monitor for hypotension because plasmapheresis has a side effect of hypotension. What next about Guillain-Barre? The most serious complication monitoring for new onset of Guillain-Barre is a respiratory complication. Respiratory complication from paralysis ascending into the thoracic region. Because I said Guillain-Barre is an autoimmune attack of peripheral nerve sheath and they can cause ascending paralysis. Monitor the rate and depth of respiration and measuring the bedside vital capacity like spirometry to see the lungs vital capacity, right? To detect any problem of my patient. Question number 3, the nurse perform admission assessment on 4 clients. Which client assessment information is the most concern and also need the priority? So there are 4 patients. What patient is more danger or which patient we go first to check? So 17-year question, patient number 1, 17 years old, suspected meningococcal meningitis. So meningitis, this is the inflammation of meninges. More specifically say, inflammation of arachnoid matter and pia matter of the brain and spinal cord, right? Inflammation, which have a fever and 103 Fahrenheit, high fever, my friend. Patient number 2, 36-year-old, who is an IV drug user and develops cellulitis in the arm, also fever 103, foul smell drain from site of injection site. Patient number 1 and 2 both have a fever, but keep in mind this one is attack the brain. Question number 2, patient number 2 is important as well, but not like the number 1. This is a local tissue damage, but this is the brain meninges get involved. Question number 3, patient number 3, 45 years old with diabetic mellitus, osteomyelitis developed, infection, right, in the bones. And also fever is 100, fever is less than patient 1 and 2, 100. and serum glucose is 1. So patient is diabetic, develop fever, develop osteomyelitis. It is bad as well, but they will not die, my friend. It's a stable patient. You take time to treat. Patient number 4, 76 years old, chronic bronchitis, who have a fever as well, 101. But number 1 and 2 is 103, temperature is super high, and produce cough and thick green mucus. Number 4 is also important, but patient will not die within a minute. So you have to take a primary measure for the patient whose brain is get involved. So meningococcal meningitis. So meningitis, what type of transmission occur? Direct contact and droplet, right? So I want to share with you, if you do not know the sign and symptom of meningitis or meningococcal meningitis, don't go for board exam. Don't waste your $200 for NCLEX board. So meningococcal meningitis, major sign I want to share with you first, nasal rigidities or tachycardia, headache, nausea and vomiting, major sign. And I said this is the contact precursor and droplet, right? So let me read it. Meningococcal meningitis is highly contagious condition that is involved inflammation and bacterial infection of the tissue covering the brain and spinal cord, which is called meninges. So meninges means inflammation or infection of meningitis. Meninges is called meningitis. It is transmitted through direct contact or by inhaled droplet, right? Like from upper respiratory tract droplet. So characteristic sign and symptom: headache, knuckle rigidity or stiff neck, photophobia, patient feel discomfort when they go under the sun, nausea, vomiting, and changes in mental status. If any of these are present or from testing, how can test the meningitis? Lumbar puncture. Lumbar puncture, the critical is this is the life-threatening medical emergencies, right? So antibiotic therapy is the treatment option. So another most important information I love to share with you, meningitis can also cause increase the intracranial pressure. An NCLEX board sometimes asks what test will be positive in case of meningitis. One is called positive Karnik sign and Babinski sign should be positive. So if your patient has a nurse meningitis, as a nurse, what is your intervention? We could monitor the level of consciousness. We can monitor vital sign. Also, we can monitor for any kind of seizure, or if patient has a history of seizure, we initiate the seizure precursor and maintain the patient, keep the patient isolation and elevate the head of the bed. So in this discussion, the collect the spinal fluid by lumbar puncture for culture to use the antibiotic. So what are the medication are used or is prescribed? Antibiotics and analgesics, right? So now let me read about here the educational objectives. Meningococcal meningitis is highly contagious bacterial infection. Classic signs include fever, knuckle rigidity, headache, photophobia, nausea, vomiting, and change the mental status, and shortly called level of consciousness. If meningococcal meningitis is suspected, diagnostic test and immediate treatment and antibiotic are critical as it is life-threatening medical emergencies, right? So let me little bit recap, little bit. What is meningitis? What are the signs, symptom of meningitis? What is the treatment of meningitis? Right? So I said we give them antibiotic or we give them analgesic, and also it is important what is the precursor, droplet precursor. If antibiotic and analgesic is not to cure, then we will collect the CSF. So the question number 5, the emergency department nurse receiving a client with a extensive injuries to the head and upper back, right? So the nurse will perform what action to allow the best visualization of the airway. So imagine suddenly somebody is fallen or any kind of accident is occurred and injured in the cervical area or neck. What we could do, or as a RN or LPN, what your responsibilities? So in this question, talking about emergency department nurse receive a client with extensive injury to the head and upper neck, extensive injuries. So immobilization and appropriate positioning is important. The nurse will perform what action to allow the best visualization of the airway. There are 4 options. Number 1, they said head should be tilted and chin left to the supine position. Number 2, head tilt and chin left in the Tendelberg. So head neck injured, neck or cervical area injured, there are nothing related to the blood supply or Tendelberg position is not necessary. Number 3, jaw thrust maneuver in a semipolar. So I said jaw thrust maneuver is important, but definitely not semipolar. Why you go for the semipolar? Then any problem in the lower abdomen, abdominal viscera, urinary bladder, respiratory problem? No. The neck region injured, head area injured. So no need semipolar. Jaw thrust maneuver in the supine, yes. When patient lie down on their back or face on the top or roof, supine, and jaw thrust maneuver. So jaw thrust maneuver is a first aid and medical procedure we used to prevent the tongue from obstructing the upper airway. So definitely jaw thrust maneuver is our first choice, and jaw thrust maneuver definitely in the supine position, not a semi-polar posture. It is not going on with the jaw thrust maneuver. So the they said the nurse who is very experienced to deal with this patient, they could go for jaw thrust maneuver first. And I said this is the medical procedure to use to prevent the tongue from obstructing the upper airway. The maneuver and the head, teeth, and chilled left maneuver are two of the main tools of basic airway management. So let me read it. So you can see this picture. This is the jaw line, right? And jaw line is extended, pressurized a little bit here. Keep in mind, carotid artery is there as well. So let me read their explanation. It can help us to understand and gather more information. The clinical situation involving trauma should follow the ABC rules. A stands for airway, B stands for breathing, C stands for circulation. Airway assessment is particularly critical in the client with injuries to the head or neck and upper back. Injury to the upper back should be treated as spinal trauma until the client has been cleaned by advanced trauma life support or qualified healthcare provider. Until the supine is approximately assessed, the client should be placed on a backboard and stabilized. The nurse should use or start the jaw thrust maneuver to avoid the movement of an unstable spine. One provider should stabilize the cervical vertebra, allowing the second provider to articulate the jaw independently to the spine column. So in this picture, you see the two person is dealing with this patient. One person is trying to fix the jaw, keep the alignment, and second person try to keep the posture or positioning of the neck. What are the educational tools? If there is a suspicious of spinal injury, the jaw thrust maneuver should be used of airway assessment to avoid any shifting of unstable vertebra and subsequent spinal cord damage. So it is priority to maintain the patient positioning. Jaw thrust maneuver could start and try to stabilize the patient or try to not harmful for your patient.